Snoring can be a real pain. It can make it tricky for you to get a good night's rest and your partner too. It can also be very serious, even fatal.
Some people are supposed to be using a CPAP machine to improve their sleep apnea, but they're just not comfortable wearing that mask to bed. So here to talk about all your options for treating snoring and sleep apnea is Dr. Kandula with Advanced Ear, Nose and Throat Specialists, or Advent. Good to see you, doctor.
Good to be here.
Yeah, I think this is probably something you have a lot of people come to you and talk about is their snoring or their partner snoring. And the fact that they need to use a CPAP machine. Let's talk first about the amount of people who have this issue. Are there a lot of people who have snoring issues?
Absolutely, tons. I mean, so it's about 40% of the population, which is a lot, who snore chronically. Not almost everybody can be a snorer if you have a cold or something like
Retired.
that. Yeah. So, or you have a couple extra drinks or that kind of thing.
Right.
But they're about 40% of the population, night after night, chronic sort of thing. And then about 10% of the population has sleep apnea. So not only are they making lots of noise when they're sleeping at night, they're stopping breathing when they sleep at night. The number of people who actually get treated is a teeny fraction of that, because a lot of folks are kind of scared about what the options might be. They don't really understand that there are a lot of different options. It's not one size fits all, and that's not okay.
Well, and I think some people think, you talked about the percentage of people who actually have sleep apnea, which is a more serious form of a sleep disorder. And then you think about people who are using the mask. I think people think, oh, if I have sleep apnea or my partner has sleep apnea, then the way it's treated is always a CPAP machine or CPAP mask.
Yeah, and which, I mean, on the good side of the equation, people have actually heard about CPAP at this point. Back when I was going through training, it was really not an understood condition. On the bad side of the equation, everybody's sort of gotten the cart before the horse, and the CPAP is a good treatment option, but the problem is it's often sort of pushed upon folks when it might be an overkill for what they have, or if they have other issues. So if their nose is blocked up, for instance, they're not going to be able to tolerate that CPAP machine. So you get a lot of folks who sort of are getting shoved this mask at them, and a lot of folks, as you would imagine, aren't real happy with that. And then a whole other crew of folks aren't real happy with the thought that, oh, I'm going to go in, I'm going to go get treated, and that's it. And that, again, that we can do better than that.
Yeah. So there's lots of reasons and lots of other options too. How about in just diagnosing it in the first place? What's something that you guys do different at Advent when you're figuring out what the actual problem is?
Two things. Three things. One is listen to what's going on. It would sound simple, but think about how often that happens. Two is look. Same thing, sounds simple. We can look. If somebody has sleep apnea, the issues are always in the back of the throat. So either your palate is too long or your tongue is too big, typically.
Really?
And most folks who have snoring and sleep apnea issues also have nasal issues, which they may or may not know about. So they may come in with snoring, but we'll look and sort of think about the nose, obviously. That's the start of your airway. So if you can't breathe through your nose and your mouth's dropping open, that's a problem right there. And so we're going to sort of stop there and say, okay, is that an issue? What can we do about that? And if we feel like somebody might have sleep apnea, we'll do a home sleep study. Simple. It's like a little head strap that you wear when you go to bed at night. One night, you bring the device back, we download the information. It tells us about your snoring, if you're doing that. It tells us if you're stopping breathing, how often you're doing that, and it tells us about your oxygen levels, how low those are going. So all those things factor in. So it's what's going on, what do we see on the data that we're getting. Then we start thinking about options. We don't think about options before we get an understanding about what's going on.
Until you evaluate. I wonder about people who might be watching and maybe they're using the CPAP machine or it's been recommended that they use it. Is it possible that someone is prescribed that and it just won't work for whatever their issues are that's causing the sleep apnea?
Absolutely. So, and CPAP is good, so I don't want to give it a bad rap, but
yeah,
absolutely, and it's a good thing. It's not a good thing. Let me go this way. The best way for CPAP to work is on a nose that's open. As I said before, most folks who have sleep apnea issues don't have a nose that's open, and so the end around is trying to put a full face mask on somebody, which is very claustrophobic. If you can't breathe through your nose and all of a sudden you've taken over your mouth airway too, it's not a fun sort of thing. And so for a lot of folks, most folks who struggle with CPAP acceptance, so most folks who are prescribed to CPAP don't tolerate it. That's sad. So about one third of patients who are actually prescribed CPAP tolerate it. So 2/3 of folks are trying to do the right thing, can't do the right thing. Most of those folks are in that sort of CPAP failure category. They have nasal issues that haven't been addressed. And so if we address those nasal issues up front, or if somebody's tried CPAP already, let's try to get the nose fixed or corrected. And then we can go to a smaller mask. That's a lot. It's a whole different ballgame with the nasal mask versus a full face mask. And then there are other options other than the machine. So there's an oral appliance, which is like a retainer that you can wear when you're asleep at night. That's pretty mellow. Same thing. You've got to have a nose that that works. And then there are procedures that can be effective too. most of our procedures, we try to look towards in-office procedures. So there's a whole sort of host of things we can do there. And if it's appropriate or necessary, we'll think about true surgical procedures. So it's really, it is a nice thing that there's a lot of different options, because it's really trying to figure out how do we make that playing board work for each individual.
You have these free public programs that are going on next week. When these are done, we'll give all the information for them. Can people meet privately with a physician and a doctor after these programs as well?
Absolutely. Yeah, I mean, the goal is getting information and then asking good questions.
All right, so next Tuesday, May 23rd is the first one. That's in Mequon. It's at 6 o'clock right on North Port Washington Road. Again, these are free public programs. You'll talk about snoring, sleep apnea treatments, and then on Thursday the 25th at 6 o'clock in Tosa. That location is right on North Mayfair Road. You can call to register at 414-771-6780 or register online at advent.md/event-form and visit there as well to make an appointment with the advanced ear, nose, and throat specialists at Advent.
Yeah, and what I like about it is you present every option.
Right.
And it's not just one option for everybody who's snoring, which I think is fantastic. Great to see you.
Great to be here.
So much.
Thank you.